So one of the things we've learned as a result of COVID-19 is that there are digital inequities all across every slice of life, if you will. And oftentimes those hit hardest in under-resourced communities and under-resourced schools.
We saw early on that our African American population was being much more affected by coronavirus, both regards to the amount of people in the hospital, the amount of people who got sick, and the amount of people who died.
So inequities are driven by things like transportation, like education, like housing, insurance status, rural versus urban. A lot of things create inequities, whereas you'll have two people similarly situated who should theoretically have the same outcome, but because of some social factor, they are having a different outcome.
I believe that the tale of the two pandemics, COVID-19 juxtaposed to the social determinants and the impact of the social determinants, it was a perfect storm. We find ourselves now realizing we've got the documented proof that there are certain populations in our country that have been adversely impacted by the virus.
We have some 300,000 South Carolinians who can't afford to buy health insurance coverage. These are people who work every day, but they work in a type of job that doesn't provide health insurance coverage for them at work, and therefore they need to get it on their own. They should qualify for Medicaid, but the state has made a decision that Medicaid is not a priority to provide coverage for people who are working but yet still low income.
What we're talking about now is, number one, accessibility. Whether or not you've got access to quality health care. And then there comes a question of affordability. Can you afford quality health care? We got to look at drug prices. We got to look at where community health centers are. We've had 4 rural hospitals to close in South Carolina in recent years. Those people are very upset about not having those hospitals in their communities. I think if we had telehealth in these communities, many, if not all of these hospitals will still be open.
When we try to reach patients virtually in the medical world, if your broadband connection or your internet connection isn't good, conversation is missed. Certain physical things that I can see over the phone are missed. Dermatological problems are not able to be diagnosed by phone if your video is not high resolution. So there is a definite disadvantage to people who don't have access to good internet.
The more our state advances our conversation around broadband and making broadband more accessible in rural communities, that there is low to no cost technology access, there's a lot of care that could be provided digitally or from a telehealth standpoint to help meet the needs in rural communities.
Telehealth is vitally important because it allows us to increase the quality of care that our students need, but it also allows us to make specialist referrals more easily and more efficiently for parents who are not able to oftentimes come into the building or not able to take off work. We can handle those experiences there. And we've also expanded our telemental health supports for families who might be in crisis or children who might be experiencing crises, help the student better understand how they can manage and navigate and cope with whatever those issues are that they are experiencing.
When it comes to racial inequities and disparities, every one of us has a responsibility, and every one of us has the power to do something. There's a health needs assessment that the state does, and you can see the communities that have needs, so you can access the data and understand what disparities exist. And then once you understand where the disparities are, you can be a part of the process to advocate for change. Talking to your lawmaker, your city council member, your mayors, your community members, or even your local hospital leaders around what are they doing to close the gaps on disparities. But you first got to raise your awareness, and I would encourage you to get involved where you're most passionate about and where you feel like you can have the biggest impact.
There's nothing that we can do about the 400 years of history behind us as a country and people of African heritage. What we can do, though, is look ahead, look forward. What do we need to do? What are some of the things that I need to personally do? What are some things that we can collectively do to make sure that the next generation has a better opportunity, and the generation after that builds upon the successes of that previous generation? That's going to take time, it's going to take heart, and it's also going to take real legitimate soul searching. But in the spirit of grace, you kind of create a space for someone who may be different, whose perspective may be different, whose life may be different, whose experiences may be different, and apply that same grace that you want applied to you, apply it to that person.